Lungs are complex and delicate organs. They can be easily damaged, and once injured, their recovery is often limited. Smoking is the leading cause of chronic lung disease. Inhalation of chemical toxins can directly irritate lung cells, triggering chronic inflammation and tissue destruction. It leads to emphysema, also air pollution, particulate matter, and gaseous pollutants induce inflammation and oxidative stress, resulting in lung damage. Additionally, frequent respiratory infections such as colds and the flu may contribute to cumulative damage of the lungs and bronchi over time. We will discuss how to clean our lungs from toxins and how to protect them from irreversible damage before it occurs. The first most evident supplement to clean and protect lungs is vitamin C. Vitamin C is a powerful antioxidant that neutralizes reactive oxygen species. Vitamin C enhances function of immune system cells, especially neutrophils and lymphocytes. This action is particularly important to protect from pneumonia, also called lung inflammation. Vitamin C also decreases risk of lung cancer development, but this effect is more pronounced if you get it from fruits and vegetables and not from supplements. It is because fruits and vegetables contain other vitamins, minerals, and antioxidants also, and synergically act on lungs than supplementation alone. Optimal and safe dosage of vitamin C for lung health is 500 to 1000 milligrams daily. Vitamin C is better absorbed in low dosages several times per day. With food, at this case, absorption is almost 90%. With high doses, it can be 50% absorption. Foods which are rich in vitamin C are: red bell pepper is liter per 100 grams. It contains almost 130 milligrams of vitamin C. Kiwi, another champion, contains around 90 milligrams of vitamin C. Strawberry and oranges contain around 50 milligrams per 100 grams. The second most important supplement is vitamin E. Long-term intake of vitamin is associated with 10% reduction of chronic lung disease in women. Vitamin helps protect the lipids in the alveolar surfactant from oxidation, called lipid peroxidation. Also, vitamin E has immunomodulating effect, which can positively affect lungs. For vitamin E benefits, the dosage should be more than 100 international units, but less than 400 international units. Natural sources of vitamin E are nuts and oils. The third important supplement for bronchi and lungs is magnesium. It causes bronchial dilation via calcium antagonism in asthma-prone individuals, and also it decreases release of histamine and inflammatory mediators. Low magnesium levels are commonly seen in persons with respiratory diseases like asthma and COPD. 300 milligrams of magnesium supplement as magnesium citrate daily for 6 months showed reduced CRP levels in people with chronic bronchitis. Also in asthma, long-term oral magnesium may help improve airway responsiveness.
They focus on magnesium because dietary magnesium intake alone may not be enough to reduce risk of respiratory disease. Magnesium typical dosages are 300 to 400 milligrams daily, which is considered safe and effective. But when taking magnesium, we should remember it has some medication interactions. Magnesium can reduce the absorption and effectiveness of certain antibiotics like quinolones and tetracyclines. It may interact with calcium channel blockers, potentially causing excessive blood pressure lowering. The fourth most important supplement for lungs is N-Acetylcysteine, which is well known for its mucolytic action. NAC's multifaceted mechanism addresses key aspects of these diseases: antioxidant, mucolytic, and anti-inflammatory effects. Meta-analysis of 13 studies, over 4,000 COPD patients, have shown that NAC reduces exacerbations by about 25%.
AC is strong antioxidant, and also it decreases viscosity of the mucus by breaking disulfide bonds in mucoproteins. NAC effectiveness is more studied in case of chronic bronchitis and COPD. In asthma, it is less effective. NAC is generally considered safe for both short-term and long-term use when administered at recommended doses. NAC has a low oral bioavailability, typically between 4% and 10% due to significant first-pass metabolism in the liver. NAC may interact with certain medications such as nitroglycerin, increasing the risk of headache, dizziness, and low blood pressure. NC optimal dosage is 1,200 milligrams daily, considered safe. The intake on empty stomach for better absorption. If it causes stomach upset, then with food intake is acceptable. And fifth most important supplements for respiratory system are quercetin and bromelain. Quercetin is a naturally occurring flavonoid in red wine, onions, green tea, apples, and berries. It is potent antioxidant.
So it affects multiple ways and reduces inflammation. It also reduces histamine level, therefore affects allergic processes, reduces allergy, also reduces leukotrienes and enhances anti-allergic action. 1,000 milligrams daily quercetin is considered safe and effective for 3 months to reduce respiratory infection risks and reduce inflammation. Even longer duration can be safe, but more studies are needed. Bromelain is an enzyme extracted from pineapples. It reduces the number of inflammatory mediators. Bromelain helps reduce mucus viscosity by breaking down disulfide bonds in mucoproteins. It has been particularly noted for reducing nasal congestion and sinus swelling. The new studies show that bromelain can reduce airway reactivity in asthma models. Common bromelain dosage is 301 to 20 milligrams taken 3 times per day. Bromelain is generally recommended for short-term use, typically not exceeding 8 to 10 consecutive days. Bromelain can increase bleeding risk. It is advisable to discontinue use prior to surgery. There is potential for enhanced sedative drug effects when taken with bromelain. Bromelain may improve the absorption and utilization of quercetin.